Hey guys, it's Bryn from Mom on the Rocks, and we are here in our Facebook private supporter group. And I'm just always excited to have expert interviews because it's a chance selfishly, for me to get to meet awesome new people and to learn new things. And I'm such a professional nerd. I love doing that. But today we get to talk to Maranda Connor, who has become a friend of mine. And it's just one of those things where you meet somebody and it's like, how have we not known each other our whole lives? And Maranda and I have kind of followed similar paths in different decisions and different lifestyle choices, as well as the populations we are passionate about serving. And so look up on the YouTube channel different expert interviews we've done with Maranda in the past, because they're really powerful. But today we're going to talk to Maranda about EMDR specifically. So that's a passion of hers. She is certified in that. She's a consultant for EMDR therapy. And I just am so excited to have somebody who not only is so knowledgeable, but cares so much about the way this can impact us as parents, as well as our extreme children. So Maranda, tell us a little bit about yourself and about why EMDR was such a draw for you.
Okay. Well, my name is Maranda Connor, and like Bryn said, I'm a licensed professional counselor, EMDR certified, and currently consultant in training. And EMDR was one of those things that when I was in grad school, I had to do an interview on a professional. And so I interviewed someone in my area that was EMDR trained. And when she told me about what she had experienced, she gave me all these experiential stories. And one that stood out to me, which again, shout out Lana Covington, because that's who it was. But about this kid that she was doing EMDR with, and like a handprint came up on his skin because he was processing physical abuse from a parent. Like, it gave me chills, and I was like, I have got to know more about this. And so a colleague and I, another one, shout out Megan Loving Counseling and Consultation in Greenville, Tennessee. Her whole practice is nothing but EMDR, BT dubs. We just we were like, let's sign up and do it. And we went to the training. We did the 2 weekends, and you have to get EMDR to become trained in it. So it's like you learn about it in the morning, and then the afternoon you practice doing it on, on each other with other providers. And holy moly, the experience of that is always what I use to tell my clients about it. So I've seen it be very powerful for me, and I've also seen it be really powerful for my clients. So it's like, the more that I got into it, the more I was like, I am so invested in this treatment because it is so versatile.
Yeah. And that's one thing about EMDR training. So for those of us in this group, many of us have either ourselves and or our children been through several different types of therapies, different strategies, all different things. And so if you're not well versed in the different types of therapies, one thing that's cool about EMDR is, unlike a lot of different certifications, I don't have to go through my own therapy to be a therapist in most instances, which is kind of crazy to think of, even though I think that's wild and everyone should have to do that. But with EMDR, you can speak from your own experiences, which is, it just kind of adds that extra layer, I think, of personal investment, which is really awesome. So talk to us about, how does EMDR differ from what most of us in this group have experienced, which would be play therapy, talk therapy, behavior, CBT, behavior therapy.
Well, and the great thing is, EMDR is like the icing on the cake, because you can use, and you do use, all of the elements of all those other types of therapy with EMDR. So if you're working with a kiddo, you're going to see play therapy elements in with EMDR, because that's just where research shows the most, the most work is. And I love a good sand tray, even for an adult. But it takes those elements. So EMDR isn't made to be this standalone piece, but it's what it brings to the table. It's so fast. It's so intense. And my favorite part is when my clients are just blown away by what comes up. Even when I try to be really conservative, so I'm always telling them, hey, this is what you need to expect next time. And then they still say, I don't know why this is coming up right now. I don't know why I just told you that. I don't know. I haven't thought about that in 20 years. And it's like, hello, it's the EMDR, right? So there's a lot of things. Our brain is such a powerful and complex organ, but yet with EMDR, it's like our brain takes us exactly where it needs to heal. So you can go in with a strategy and say, oh, we're going to work on A, and then you might end up working on W. The brain will show you what you need to do. And then clients often get a really quick positive response, and then they're invested. So the longest I've ever had a client do EMDR with me is for 2 years. And he just was so invested. He got to where he's like, okay, we're doing future templates. We're doing present triggers. Like, and so that's not always the case. And I learned that, you know, even in training, most people feel good and they opt out of therapy. But it's really, really neat in that from a diagnostic standpoint, there's really not many diagnoses that can't benefit from EMDR. It gets the idea that even though it's been around for over 30 years, okay, that it's only for trauma, which is so untrue, but we could spend a whole nother time. That might be something we need to talk about of what trauma is, right? Because people are like, oh, Miss Connor, I wasn't molested. I don't have trauma. BS. There's so many other traumas.
For sure.
But it gets that idea that it's only for trauma, and that's also bogus. There are so many protocols now. And when I went to the EMDR conference earlier this year, someone quoted Fran Shapiro, who was the creator of EMDR. She passed away in 2019. That one of her last speaking engagements, she said she wanted EMDR to stand for every mental disorder recovered. And that gives me chills even repeating it. And I've said that so many times because she wanted it to grow, and it has been growing. But she wanted to really reach every diagnosis, every mental issue. And so, I mean, that's kind of the path that EMDR is on. Although despite in this area, it still feels relatively new. You know, insurance has just now started compensating for it, and I think that's why people think it's new. But it's also an expensive training to do, and so that's why it's not as out there, I would think. So if you find a clinician that has it, likely they have invested that money themselves. I did, because I just so believed in it and wanted my clients to have it. But there's a lot of organizations that are trying to bring it to rural areas. Because just because we're rural does not mean that we do not have, you know, big city levels of mental health.
So if I'm a mom, well, I am a mom who has diagnosis like PTSD, CPTSD, OCD, and anxiety. Those are my diagnoses. So I come to you, but I think I haven't really what we call big T trauma. I haven't really had any big T traumas, right? So how could EMDR help? What might I expect if I'm coming to you and we're doing an EMDR? Because a lot of people, they might research it a little bit, but they're reading a lot of big terms like bilateral and stuff, and they're like, hold on, what is she going to do? What is this voodoo witchcraft, like hypnosis? What is happening? So walk me through it.
I love that you said voodoo witchcraft, because I tell my clients it sounds like voodoo magic. And so again, that connection, right? Really, it's going to be the whole, if you want to meat and potatoes, EMDR, it is that negative things happen, and that then we have this core negative belief about self. And then every time something else happens that falls under the line of that, like, I'm not lovable, I'm not good enough, whatever it is, I'm bad. If it's a little kid, it just kind of grows this cluster of ick. And so with EMDR, when we're treatment planning, which is at the very beginning, we're going to focus on whatever you bring to the table. So we're going to do some history taking, and we're going to say, you know, hey, where do you want to start? We'll focus on that memory, and there's some different techniques that's called the float back or the affective bridge, and we'll find things that are connected to that memory. So for example, again, I love to pick on myself. When I went to this training, we had to do the same thing for me. And so here I am in front of 50 other providers, and I'm like, I don't want to pull my whole business out here, right? So I'd had a conflict with a coworker because, again, I was a little baby therapist and thought I knew everything. That had really ticked me off. So we focused on that. And my negative cognition was I'm not capable because this other clinician had challenged me. So we did a float back, and it took me back 22 years.
Oh my gosh.
Okay. To a middle school presentation. I was running for some kind of, crap. Who knows what it was that I hadn't remembered, but there were visceral responses in my body to that memory. So now, fast forward, we processed it, me and my partner there. Now I can bring up that memory, but the memory has changed. So, for example, this is what EMDR does.
Mm-hmm.
I was on the stage, so immediately my hands felt sweaty. I could feel the spotlight. There were people in the auditorium. Now when I bring it up, there's nobody in the auditorium, and I don't have any of those other visceral things. I'm just like talking about it like it is leopard print pajamas, right?
Yeah.
Like it's nothing. There were 3 other memories that were in between that and my present memory that I have no clue what they were. They came and went, and it hurts my brain to try to reach out and grab them. And then that initial memory, which was of somebody sending me a nastygram email, all it is a white block on a computer screen.
Wow.
That's how EMDR changes your memories. And again, it sounds like voodoo magic, but once you experience, you're like, holy heck, like this really works. So that's really what it was, is finding out that there was a string of memories that were negative to me, that were connected to this belief that I'm not capable. And so you process through, but then you install that I am capable.
Mm.
So it sounds like a super complex, but your brain just knows what to do.
Mm. Yeah.
So
how does that look for kiddos? So how would that be different when you're walking through? So, well, let me back up for just a second. We talk about, for those of us that have researched it a little bit or experienced it ourselves, there's the bilateral stimulation. So some people use, like vibrations, lights, different things, eye movement. So talk about what just that basic, like the physical process. What does somebody experience in that?
Okay. Yes, bilateral, or you'll hear me say BLS lots of time, which is just bilateral stimulation. It is literally just moving your body in a pattern on both sides of the midline. That is pretty, like, in a nutshell, that's what that is. I'm a huge fan of the buzzies. That's the vibration. They're little handheld devices that vibrate back and forth in a pattern that's controlled by me as the clinician. There is eye movements, the good standard back and forth. There's some diagonal ones as well. There's a light bar that moves your eyes for the clinician. Any mechanical device that I speak of is just for clinician fatigue. In various different parts of my practice, I have done, up to 8 hours of EMDR therapy in a day. So your little arm gets a little tired, processing. And these sessions can be anywhere from like 60 to 90 minutes, just depending on scheduling. So those are just to help us. Mm-hmm. I'm a huge fan of the buzzies, especially with little people, but there's also tactile. So you can do tapping. Mm-hmm. I've done a lot of that with kiddos, tapping the palm of their hands, tapping their shoulders. But for a little bitty person, again, I love using the sand tray. There's different art and craft type of things. But so for them, it may look like we're going to set up miniatures to identify what the memory is that we want to focus on. And I will have the buzzies in their pockets. There's all kinds of neat little buzzy things, like little things you can put around them that the buzzies pop into on both of their shoulders. I've heard people put them in their socks. Mm-hmm. There's all kinds of different things, whatever your kiddo can tolerate. And then as we're processing it, we're also moving things in the tray. So that may be, here's this negative memory of something that's happened, and we're going to insert helpers in there. So, the police showed up, or here's a firefighter that came, or, whatever it does look like. And it could even be for behavioral modification. So I did this when I worked in the CSU with kiddos. Hey, Miss Connor, I feel really, really mad. Okay, let's talk about being mad. I want you to focus on being mad. tap, 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 and be able to de-escalate and focus on what that emotion looked like and making a better decision. Hey, you ask for help. Let's install that.
Yeah, for sure.
So it really just depends on the kiddo and what they need. But like I said, there's really not, it used to be, oh, we don't use it for psychotic disorders. That's out the window. We now use it for psychotic disorders. So honestly, for me, the only problem or people that I would turn away are people that are not compliant in therapy in general. So that's like the biggest piece. And then we may have to build up some supports before I'll start. I will tell you guys, and again, there's all kinds of different providers. For me, I'm not somebody that you walk in my office and say, I want EMDR, and that day you're going to get it. Like there's a build-up process to this. There's a relationship building that is imperative to have good therapy. So I want to know.
Talk about that. Why is it so, I mean, it's important anyway to have good rapport with your therapist, obviously, if you're going to get a good outcome. But with this specifically, because it is so fast paced and so intense, why is it like a crucial element of progress?
Well, there's layers to it. So one, you can fight it. So, and that happens so naturally in the beginning, but there's a lot of trust that needs to be. Here's my therapist that's doing this really weird thing and making me feel some big emotions really fast.
Yeah.
My most successful clients are ones that we took the time to build that trust, and they knew that I am not taking them out into the river and leaving them behind. Like that we're going to come back together, that I am here with you through the process, and that I'm paying attention to what you're doing, and so that I'm going to respond in ways that are helpful for you.
Love that.
But even more so, it is that I want to be able to notice from body language with my client what's going on with them, so I know when to change up speeds or, put in like a verbal, reflection or response or draw it back. I like to have that. And I mean, I work really hard, and that's the norm for me, is to be able to tell by a grimace on a face or a change in the way they're seated, to say, okay, let's turn this back a little bit. I'm going to do a check-in. Let's see if we need to go back to target, those kind of things, because those are crucial. Like during EMDR, there's not a lot of speaking back and forth. It doesn't look like traditional psychotherapy in that way. So as a result, I am looking for all the other communication behaviors that my clients are doing. So the better I know you, the more I know, oh, they're tapping their left toe. That's what they do when they're anxious. Okay, let's do a check-in. What are we feeling in our body right now?
Yeah, and I think one thing that's important, I'm glad you mentioned that it's not like traditional talk therapy, and it's even less about, like, I think a lot of people in Western cultures, we think we go to a therapist to tell our problems and get advice, which is like the opposite of what they teach you in grad school. They're like, don't give advice. You're a listener, you're a guide, and so it's just kind of funny how our culture presents what therapy is, and it's actually not. So with EMDR, it's even further away from that, because you're allowing yourself, no, you're fully conscious. It's not like hypnosis. So that's a myth about it. You're in control of your body. You're in control of what you say and do. And the therapist is really just there to make you feel safe and to, like you said, read what's going on with you. And I think it's a really cool way that's why it walks through. And we just, saying it's relatively new, I think what's important to note is studies at all about the brain are relatively new. We just don't know yet. I mean, as advanced as we are technologically and in medicine, we just don't know why the brain does what it does yet. And so it's not saying that there's a lacking in the therapy or in the proof of how it works. It's just that we're still figuring everything out. So talk to me about, as parents, as extreme parents, we worry about how our kid's going to respond to basically anything. Going to a restaurant, going to school, having a therapist, I mean, any of it. It doesn't matter. And so changing their cereal bar, I'm going to have a whole meltdown. So talk to me about, our body does have visceral responses in EMDR. So if you have a kiddo in there and a memory comes up and it is surfacing some stuff, what does that look like from the clinician's perspective? How do you keep that child safe?
Okay. So the hope would be there's been this workup of what's going to happen. You're reminding, because one of the things we do is we want to have our clients have 1 foot in the past and 1 foot in the present with us. So if it becomes a huge visceral response, the biggest thing I'm going to do is say, okay, let's take a breath. You're here with me. Let's name something that we see. We may throw a ball back and forth, whatever, to bring that kiddo back presently with me, and really to be able to remind them, one of the scripts in EMDR is we're on a train. We can see things out the window and we just notice them and let it pass us by, but we can't reach out and grab a hold of one of those trees, and it can't reach in and grab us, and reminding them that that was just a memory. One of the biggest things that I tell clients, especially when there's big memories back there, is that it will never be as scary to relive or resense any memory than it was the very first time that you went through the actual incident. That is a myth when we look at trauma or big, therapeutic issues, is that, oh my goodness, who wants to think about this again? It was awful. It was awful. It'll never be that awful again. Like, you are still standing after you went through that. You are a rock star, and that we are strong.
Right.
But also allowing my parents and my kiddos to know that, like, big responses are totally okay, and that it's kind of like purging it out of our body.
Yeah.
So, that we might expect irritability. Most of my clients, and I will say, I hate math, but, in the 90% of just have really, they're really tired afterwards, and they have phenomenal sleep.
Yes.
And so when I worked at the residential facility, I had kids put in requests all the time to see me. Hey, can you do that buzzy thing to me? Because I want to sleep good, right? Like, they didn't even notice the big work we were doing, because for them, they were real focused and like, hey, I slept great, and that's so abnormal for me.
Yeah.
But even just walking them through and letting them be a part of that process. You've created a safe, calm place, or honestly, for me, I'm a huge fan of the container. And so reminding our kiddo that, hey, this really big memory came up and it's too big for us right now. Let's put it in our container and close it up. We do not have to address everything that comes up. Like, you don't just like bust open Pandora's box and you're in it.
Right.
We have control to say, oh, you're bigger than what I expected you to be. Let's cut this in half and put half of it away, or hey, let's put it all away and let's go back to some calming stuff. Because allowing the kiddo or whoever to know they're in complete control.
Yeah, so from a practical standpoint, as both a parent and just an individual, I would recommend, if you are going to experience EMDR just yourself, or you're going to have your child signed up for that, is to don't do it at the start of a school day for them. Don't do it when you've got a meeting and 15 other things going on. Allow yourself at least like an hour or two afterwards to just decompress, whatever that looks like for you. And even if you're not actively processing what came up, if you're just breathing, if you're just walking, if you're just eating lunch somewhere by yourself, I mean, whatever it looks like for you truly. And then the other thing you mentioned that I think is wildly important and really sells EMDR as far as I'm concerned is, unlike traditional talk therapy, which there is a place for that for sure, but you're not just reliving the experience, talking it through, and maybe being given some strategies. Okay, if I feel anxious again, or if I feel this feeling again, then you can X, Y, or Z. Because as we know, as extreme parents, we have a toolbox that is like 9 million pounds worth of stuff that we try and works today and doesn't work tomorrow, and back and forth, right?
Yeah.
The difference is EMDR is actually walking you through things and healing you from those things. So like you were saying in the beginning with your experience, it actually doesn't even look the same anymore. So if it were to come up again, it is not going to look or feel the same in the future. So that is the huge difference, I think, between what we know in America as traditional talk therapy and EMDR.
Absolutely. Well, and I explain it, especially to kiddos, of, have you ever had a bee sting? EMDR takes the poison out of the bee sting. So I can't change that you got stung, but I can change that you're not going to still feel swollen up and itchy, after the fact. or painful or whatever it is, that we can't change the event, but we can change the way that you now look back at the event.
Yes.
Now, I will say the disclaimer, some of my clients have completely, like the memory completely blank. I always tell my clients that as a disclaimer. It is not like Men in Black where I'm like, look at my little thing and flash and everything's gone. And I will tell you, none of them were angry that they lost that. That was not until I really started working like some super complex trauma and dissociative clients. We were doing a check-in after our first processing, and I was like, okay, I want you to pull up what we had processed, last session, which was 2 days before, by the way. And kiddo just starts bawling her eyes out and says, I have no clue what it is, and was like crying in relief. So that is when, and it's happened probably, 20 or so times after that. Because I will tell you guys, when I meet a client for the first time, whether I'm in my current position or any others, the first thing I'm thinking is, how can we EMDR this? Let me pull out, the tools from my toolbox, because for me, it's that versatile.
Yeah.
Of looking at and starting to tell the kiddo about it or the family about it. But I mean, that is huge. That things that have made these clients, before that, when she brought up that memory, she would physically vomit. It was so traumatic for her to have that relief of it's gone.
Yeah.
But most things, it just fuzzes it up. It takes away. And, I referenced earlier about there's other memories that I know are there, but I just can't really reach out and grab them. It hurts my head. My brain's doing that on purpose. So, okay, I'm chill.
Yeah.
Right? Like there's no reason for me to pull. But that's the most beautiful part as a provider, is seeing people that, especially in the detention center, kids that have been through numerous therapists, numerous attempts to address issues. And then you get in there with EMDR and you really start doing some work, and then you hear from these kids 6 months later and they're enrolled in college.
Yeah.
Or they're doing, they're sober in the community for the first time in their life, because trauma was addressed.
Yeah.
And big T, little T, medium T, whatever you want to say, it doesn't matter, that for the first time there was healing, and that's powerful.
Yeah, for sure. So sum it up for us, and we will have to do a whole other review on trauma, but sum it up for us in just like a 2-minute synopsis of, as a provider, we know it's supposed to feel like our safe space, but as somebody who has a really hard time identifying emotions personally, and I'm somebody that thinks everybody's got problems, I don't need to share this, like they don't need, whatever. And so you might make me feel safe to say anything, and you might validate those feelings, but what are some examples of trauma that are beyond things that we might instinctively list, such as surviving a horrific accident, or having seen a homicide, or having experienced sexual abuse or child abuse? What are some other things that are actual traumas and can cause our bodies to respond in that way?
One of the biggest things I see is any kind of attachment injury, are the biggest. So that is, emotional abuse. Like if we want to really break it down, I know we talked about Bessel van der Kolk, fangirls over here,
yes.
Right? The top 4 most severe traumas for children, okay? Number 1 is emotional abuse from a caregiver or parent. Number 2 is unresolved mental health issues from a caregiver or parent. Number 3 is witness of domestic violence. And number 4 is neglect. And that doesn't even have to be, we don't have electricity and we don't have food, but that we learned from a young age that when we needed something, somebody wasn't going to respond. Right. So it may be that we were a stuffer and we didn't tell our emotions, but we never had anybody that picked up and said, hey, you don't seem right. Are you okay? They just let us be okay. So that can feel neglectful. But it's really just the perspective of what we have went with. A lot of family, not having people that we can trust. Yeah. But it could really.
You were saying emotional abuse, and I want to point out that I think when people hear that, if they're not well versed in therapy, they might think that means verbal abuse, or somebody saying like, you're not good enough, you're fat, you're ugly, you're whatever, incapable in some way, right? Which should, certainly that falls under that. However, that also can be, as a child, being expected to play a parental role, being expected to parent your parents. I mean, there's a lot of things that fall under that we might think, well, that just was my life, and we might not even think that was that big of a deal. It was just how we grew up. And so I think it's really important for us to recognize and identify those really are traumas that can stick to us in our bodies and our brains, and affect us as the way we parent, the way we are a spouse, the way we are a friend. So
yep, absolutely. Well, and as a fellow person that loves them some boy clients,
yes,
one of the ones that I hear the most come out of my mouths is, stop crying, men don't cry, this is a sign of weakness. That is a huge piece.
Yep.
But even some of the societal pressures on males and females currently, those can become attachment issues,
yes.
right? So, the way that we perceive ourselves in conjunction to. But I can't tell you if I had a nickel for every time I heard, oh, I'm not allowed to cry. That means I'm weak. I'm supposed to step up and be the man of the house. And that really creates some deep-rooted hurts.
Yes. And that can be from the female as well.
Absolutely.
Yeah.
Absolutely.
And I think a lot of times, and I know you and I have both worked extensively with the detention population, but a lot of the times that we get females that are the ones that try to present this like, peacock and hardcore facade and whatever, are the ones that had so much expected of them and have been so wounded. And so that's their survival mechanism.
Absolutely.
And that's their fallback. And so I think being able to build that rapport and break that down is crucial, obviously, for them.
Yes, absolutely. Because it is a survival mechanism that, when I needed people to consistently show up, whether it is just respond, they weren't there, and it creates a wall.
Yeah, for sure.
And it hardens the way that they respond to emotion. I did want to go back and say the great thing about EMDR, guys, is you don't even have to tell me as your clinician what you're feeling. So if you're somebody that's like, feelings, ick, get them out of my face, that's fine. There is a way to adapt it to where you can process an experience, and I never know really what it was. Now I'm going to tell you, knock on wood, I've started on that a couple of times with clients, but I've always been able to build the rapport till they end up telling me. I've always been able to, when clients come in and say, hey, I'm here to work on this, but don't you dare touch this and this. We've always went back and done those with the clients saying, okay, let's do this.
Right.
So again, that's a focus on that relationship building, that if you really have it and you vibe with your therapist, I tell that to my clients all the time. If you don't vibe with your therapist, get a new one. It doesn't hurt our feelings. Shockingly, I'm not everybody's cup of tea, and I'm okay with that.
Yes.
But that you've got to vibe with your therapist. And when you have that vibe, you are going to, like, so much wonderful work is going to be done. And us as clinicians just want you to have success, whether it's with us or not.
Right. Absolutely. And that, I meant to say that actually, something you said a while back made me think of that. And it's from The Body Keeps the Score talks about that kind of magic where you don't have to tell your clinician exactly what happened, but still get the healing from it. So that's a really cool part for those of us that do struggle with, and our kiddos. I mean, I know both my son and myself really just it's foreign to us to name an emotion. We can say we feel icky, or we feel mad, or we feel whatever, but if it's not a functional emotion, it's difficult to identify it, and it's certainly worse to even figure out why, like, what is happening here, And so being comfortable sharing those things is, kind of cuckoo. And so it's cool that works even without that piece. Okay, so before we end, I want you to tell us, where can people figure out, because we have people that join us from all over the globe. So is there one place they can go to find somebody or to learn more about EMDR that they can make it personal for themselves?
Absolutely. So one thing about EMDR is I tell my clients, Google it, just don't look up on Wikipedia. But the main space is EMDR IA. So it's the Eye Movement Desensitization and Reprocessing International Association.org. That is where you can click find a therapist. Any therapist that is listed on the registry, so I'm on there, you can click and say you want to look at only certified clinicians, which is like the second level, by the way, guys. That does not mean they can be basically trained and they can still give EMDR. But you want a provider that was trained by EMDR, so that's a question you want to ask in the beginning. There's some other types of EMDR out there. They're not as regulated. EMDR is kind of like the gold standard. So you can hit find a therapist. There's lots of information about EMDR on there. And so that is the best place to find it. But there are books, you know, Getting Past My Past by Francine Shapiro is on Amazon. That was like her book contribution to like the lay people. Do not read one of the EMDR solutions books. That's like reading about trigonometry. But Getting Past My Past is filled with case studies. So people that shared their story. That is where I got the whole, these people are getting paid to write this stuff, but it's true. But it's in a much more understandable format for people. So you can also find around most of the bigger mental health agencies. You can call and say, hey, do you have anybody that's EMDR trained? And then, like I said, going in and asking the questions, you know, that I have a huge certificate in my office. So you don't even have to ask me where I got my training from, because I want my clients to see it and make those, you know, educated decisions and go into it and, you know, try it out and see what you think.
Yeah. Well, as always, I love having you, and I'm so grateful for your time. You guys can always, Miranda is a part of this group, so you can directly message her in the group. You can message me and I can connect you via email if you're more comfortable doing that. But reach out. She has made herself available to answer specific questions. I'm not EMDR certified, so I can't answer those questions outside of my own experience. So that's why we bring these experts on, and that's why I'm so grateful. So we're going to set up a time. We're going to have another talk, and we're going to talk about trauma, because I think I'm so glad you brought that up. It's so crucial that we are able to identify and be validated that it doesn't have to be some major event to have affected us in a big way. So, Miranda, thank you so much. And I'm sure that we will be getting together very soon.
Absolutely. Thank you guys so much.
Bye.